Good afternoon, good morning, good evening. Welcome to this session. We are waiting a couple of minutes for others to join. Can you hear me and see me? Please write in the chat. Welcome to this session of the Water Week at Home. My name is Alejandro Jimenez, Director of the Department of Water and Sanitation here at SIWI, at the Stockholm International Water Institute. And I have the pleasure to be facilitating this session, which would be around the topic of progressive realization of the human right to water and sanitation. This session is convened by a number of organizations, like the Office of the High Commissioner of Human Rights, UNICEF, WASH United, WaterAid, and ourselves, SIWI. But as you know, at the Water Week at Home, we are having short sessions. We aim to be around 45 minutes long sessions where we want to discuss a lot of interesting topics. So I won't take a lot of time in the introduction. Please use the chat box if you want to raise any question, and we will come back to that in due time. So just to tell you a little bit the structure of the session, we will have first a keynote address by Mr. Leo Heller, the UN Special Rapporteur on the Human Rights to Safe Water and Sanitation, as you know him very well, I'm sure. And then we will be having some country case studies. So the first one will be by Ms. Fauzi Aliu from Ghana, working at Advocacy and Policy Officer at WaterAid. The second one will be by Dr. Samuel Godfrey from UNICEF Eastern Africa region, and we will talk us about the Global Compact for Refugees. We will then have questions and answers from you and discuss around these three presentations and the important issues that they raise. And Ms. Luisa Gosling, Chair of the Rural Water Supply Network and working for WaterAid, will do the concluding remarks. So without further ado, I have the pleasure to give the floor to Dr. Leo Heller. Leo, over to you to illuminate us about the concept of progressive realization, maximum available resources, and minimum core obligations. Thank you very much. Leo, over to you.
Thank you, Alejandro. Good morning, good afternoon, good evening to everyone. So the issue of progressive realization of the human rights to water and sanitation raises several questions, several discussions, several interesting discussions. Firstly, the definition is that states have a legal obligation to progressively realize the human rights to water and sanitation using the maximum of their available resources. This statement looks somewhat dry and doesn't speak directly to the water sector. Most of the providers and practitioners who have the feeling that this is just a legal language that makes little sense to those in the ground. However, I'm convinced that when we dissect the concepts behind this statement, we have a powerful framework for making decisions about how to implement and extend services to those who most need them. In a simple image, the concept mobilizes us to look at the reality not as a picture, a photograph, but as a film, a movie. It reminds us that reality is dynamic and that when deciding to intervene on it, we need to think strategically, making the best decisions on how to move forward in the implementation of the human rights to water and sanitation. And this is extremely relevant since almost all countries have a huge gap to be filled in providing universal access to water and sanitation services for all. Thus, the effort of the report I recently submitted to the Human Rights Council is to clarify how to translate the obligation of progressive realization into the language of the water and sanitation. In this context, the obligation comprises several components, each of which needs to be achieved if the obligation as a whole is to be satisfied. In the report, the concepts of progressive realization of human rights, of using the maximum of the available resources, and of fulfilling the minimum core obligations are addressed. I unpacked the three constituent parts, clarify each one, and then provide an integrated analysis of the concept, illustrating ways to monitor its implementation. So first, let's look at this first part of the concept, the progressive realization. How to move towards the full realization of the rights to water and sanitation? What steps should states take? So these are two very key questions. The specific steps taken might depend on the context. For example, on the level of water and sanitation development in a given state. So context matters. Regardless of the dynamic contextual elements, contexts are two deep strategies. Progressively improving the level of service towards fully meeting the normative content of the human rights to water and sanitation, and also the human rights principles. We call this strategy as a vertical realization. Progressively moving enjoyment of the human rights to water and sanitation by targeting the unserved and underserved groups. We can call this strategy as horizontal realization. The need for states to move beyond sanitation and to progressively realize the related rights should not be seen as merely moving up the water, sanitation, and hygiene ladder, the so-called ladder of services that are defined by the monitoring of the SDGs. This is particularly relevant if climbing the ladder is only part of the population. So we need to think on the whole population, particularly the underserved and the unserved groups. So rather, progressive realization points toward the need for states to take stock of the compliance with the human rights and to identify how best to achieve the adequate level of services for all without discrimination. So non-discrimination is a very key element on this strategy. Such a horizontal approach implies devising plans and schemes aimed to reduce the gaps in access to water and sanitation among individuals and groups. So the second concept is the the use of the maximum of the available resources. I would say that for that, each of these three words require clarification. Maximum, what's the meaning of maximum? What's the minimum of available? What's the minimum of resources? This concept operates as a qualifier of how states are fulfilling the obligation to progressively realize economic, social, and cultural rights at large. It qualifies two aspects of the obligation. First, why a state has failed to meet that obligation. And second, how states should progressively realize them. Limited available resources may constitute constraints to the progressive realization of rights, particularly for developing states. And in some circumstances, this might justify a lack of progress on realizing the rights. However, the concept functions as a framework and a methodology for states to operationalize and implement the obligation of progressive realization. This affords states some level of flexibility, which in turn creates a need to clarify implementation standards and to provide a clearer implementation of several aspects of what is meant by maximum of the available resources. A few points on that. First, contrary to the widespread understanding, the word resources does not refer solely to financial resources. Other types of resources, such as natural resources, human, technological, institutional, and informational resources, are crucial in achieving the rights enshrined in the International Covenant on Economic, Social, and Cultural Rights. Second, the word maximization, maximum available resources. The state should maximize their financial resources by making efforts to create more resources to ensure the enjoyment of the human rights to water and sanitation. In general, financial resources can be made available through public finance, which includes a range of possible sources, such as government revenue, official development assistance, borrowing, monetary policy, and financial regulation. Taking a broader view of the notion of resources, the states are also required to increase the availability of non-financial resources, such as institutional, technical, and workforce, as mentioned before. Beyond maximization of the amount of the budget allocated, so allocation is a concept, and this is done at the planning stage. The subsequent step is spending, so spending dialogues with availability of resources and the use of those resources, which relates to an efficient use and corruption control. So the efficiency in the spending of the available resources is something key in this concept and is related to the whole concept of using the maximum of available resources. A third definition in this whole framework is the minimum core obligation. This is a very important definition and should be assessed together with the definition of progressive realization. So all human rights are fundamental, and each right gives rise to inviolable entitlement, namely the most basic, lowest level of rights that all people of instance. The inviolable element of a right is an essential minimum that must be guaranteed for all persons in all contexts, even in unfavorable conditions. In simple terms, the minimal core content of each right can be compared to a floor below which the conditions should not be permitted to fall, and also to a house that provides feasible structure and an enabling environment for people to enjoy entitlements as part of their rights. For defining the minimal core content of the rights to water and sanitation, a transformation is required from the traditional quantitative approach to questions centered on people and the social and economic environment in which they live and work. Or suggests core obligations of the human rights to water and sanitation in the report. Instead, based on legal definitions, I provided conceptual and empirical elements to inform states' processes those definitions, taking into account the specific contexts. Given that those definitions, we need to think on how to monitor the progressive realization of the rights. At the international level, the human rights treaty for the rights. When the Committee on Economic, Social and Cultural Rights reviews states parties' compliance with covenant obligations, it prepares a list of. Unfortunately, those issues often lack specific requests for information on access to water and sanitation, subsuming the monitoring of the rights to water and sanitation under the rights to adequate standard of living or the right to health. Therefore, the monitoring of binding obligations is left to peer review mechanisms such as the Universal Periodic Review and to regional human rights mechanisms. In this monitoring process, I think that carrying out a dynamic analysis, which involves comparing the evolution of the realization of human rights over time, is the best way to capture how states are progressively realizing the rights. The data set of 2 or more points in time can be compared and checked against indicators and benchmarks, identifying whether states are making adequate progress towards achieving the human rights to water and sanitation. A specific example of dynamic monitoring can be found in my project of follow-up, which assesses the implementation of the recommendations I made in my official country visits. During a total of 9 official country visits, I assessed the human rights situation of the country at the time of the visit, and afterwards I followed up the status of each recommendation in 7 out of 9 of them. Last year, I presented to the Human Rights Council the follow-up reports of Botswana, El Salvador, Portugal, and Tajikistan. And I will present next month to the Council the reports of the follow-up of Mexico, India, and Mongolia. In those reports, those 7 reports, I classify the status of the recommendations in 6 categories: good progress, progress ongoing, limited progress, progress not started, unable to assess due to lack of information, and retrogression. So each recommendation was classified into one of these 6 categories. So I invite all of you to read those reports, because I think these are an interesting way to assess the progressive realization. Why did I embark in this follow-up exercise? During my visits, I had a strong engagement with people in civil society, and I found that only a report of the visit presented to the Council would be not enough. I felt that I have accountability to those people who took the time to meet with me and those who opened their homes to me. Together with the engagement with the government, this is one of the main reasons that made me decide to embark on a rather ambitious task of following up to my visits. So this was the main aim of that. And I think that this is a good example on how to monitor the progressive realization of the human rights to water and sanitation, among other different methodologies
Dr.
monitor these realizations.
Dr. Leo.
I finalize. Sorry.
Yes.
Sorry.
Please, you were saying your closing remarks.
These are my final words. Thank you, and looking forward to vivid discussion.
Thank you very much, Leo, and thank you very much for explaining the concepts of included in the report, as well as then also offering a concrete example through the periodic evaluation of your visits and the progress on how this can be monitored in a dynamic way. So I would now give floor to the next speaker. For the participants, keep including your questions. We will collect them at the end of the 3 presentations also, because there is a little bit of delay, so that all the participants have time to digest what we are saying. Otherwise, we wouldn't capture all the questions. And without further ado, then I would like to give the word to the presentation by Ms. Fauzia Aliou, who is Advocacy and Policy Officer at WaterAid Ghana, and who has pre-recorded the presentation to avoid the connectivity issues, and we will proceed to play it right now.
Hi everyone, my name is Aliou Fauzia. I work with WaterAid Ghana as the Rooted Advocacy and Policy Officer. My presentation today will focus on the challenge with accountability for the realization of rights in practice. It is against the backdrop of challenges in the decentralization process that should support progressive realization of rights for all. It will also look at how WaterAid Ghana seeks to build accountability in the provision of water and hygiene and sanitation in Ghana. Ghana's commitment to protecting and promoting human rights has been rated relatively high. Public awareness and government commitment to protecting human rights have been growing tremendously. However, this may not be so for some marginalized groups living in rural communities. Ghana has ratified the treaties relevant to human rights to water and sanitation and has supported some UN resolutions. Again, Ghana has celebrated the creation of 254 metro, municipal and district assemblies. Creating more MMDAs is expected to deepen the decentralization process and promoting participation of people, thereby bringing governance closer to the people. However, the needed but difficult reforms that would truly improve the ability of local government in Ghana to provide services are being pursued with less. Challenges with progressive realization of rights. One of the key challenges we have faced and we have identified is the practice of decentralization in itself. The local government is solely responsible for the implementation and accountability at the local level. The standing of the district assembly is clearly stated in the 1992 constitution as the highest political authority in the district, with deliberate legislative executive powers as in Article 241. Thus, in theory, accountability is supposed to be downwards. The planning process driving district development is to be led by communities. That is, technically, they fully participate in the process, such that all development plans are reflective of the needs of the people. However, this is not so. The district chief executive is appointed by government. Thus, accountability tends to extend upwards to line ministries within the central government. This seriously inhibits the ability of assemblies to respond to development of people. The second challenge is the capacity of the MMDAs to deliver the much needed services. Assemblies often lack the capacity in terms of awareness, staff capacity, and others to support the delivery of services to communities, especially marginalized groups. Communities are sometimes unaware and do not know their role in the process. It is however the mandate of the local government to ensure communities are informed and educated on their rights and rules, and to support them participate. This has not been seen. This is not so. For example, we see communities going to assemblies with vows, basically thinking they have to beg or are being favored when some services are rendered to them by the assemblies. WaterAid Ghana is committed to human rights-based approach. Therefore, the principles of HRPA has guided the design of our programs and projects. They strengthen our projects. We have looked at it, we've taken two-pronged approaches. Firstly, we strengthen the demand for rights, using rooted advocacy as a key priority. Secondly, we strengthen the capacity of the state to be responsible by creating knowledge and awareness on rights in general, and especially rights to wash, focusing on the need for participation, non-discrimination, transparency, and accountability. We have had a number of challenges. We try to build sustainability in the measures into our projects and programs, but still issues around sustainability pertains. Another challenge for us in this fight is scaling up of some projects can be challenging. One, due to funds. And we have actually had very exciting outcomes of our projects and programs, and it holds a lot of promise. But we are careful not to do too much of what the local government is mandated to do. There's been growing interest in the communities, but then we are unable to reach out to all communities. We've had a number of lessons that we have taken in implementation of our projects with the right-based approach in mind. One of the lessons we have learned is the assumption that the duty bearer ultimately knows their obligations. We have realized that most of the time they do not. And we also know another lesson is that building a critical mass and a network of communities yields very, very quick responses and results. And there's also the need for communities to keep pushing back on excuses of local government. And we have also seen that some assemblies have prioritized and then deliver much needed services to some communities because of this constant pushback of communities, and they beginning to feel that no, this is not a favor. This is something we are entitled to. So if we can get a critical mass of young people, then we are sure to see a way forward. Thank you very much.
Thank you very much for that intervention, bringing the concepts explained by Leo into practice in terms of accountability at the local level and how to bring this progressive realization into practice with, of course, with its challenges, as you mentioned. Please type also your questions for the intervention of Ms. Fauzia Liu, while I give the word to the last presentation before the question and answers, which would be carried out by Dr. Samuel Godfrey, who is the Water and Sanitation Advisor for East and Southern Africa in UNICEF, based in Nairobi. And he will tell us about the Global Compact for Refugees and its application. Over to you, Dr. Samuel, and thanks for being here.
Thank you so much. Thank you, Alessandro. And I'm very delighted to be here and also to follow on from the excellent speakers before. I think as Dr. Leo has mentioned, the concept that we're trying to discuss here is really the step to the realization of human rights and progressively improve service levels so that we can achieve those. So I'll try and build on the the concepts that he has mentioned, as well as the concepts that Fauzia has mentioned in her presentation regarding maximizing the use, particularly of community resources that she's mentioned. So if we go to the next slide, what my presentation will focus on is really trying to bring into comparison the human rights to water and sanitation and the Global Compact for Refugees. As we've heard from Leo, the human rights to water and sanitation are really international law. They're resolutions and approved at the UN Assembly. And they're really designed to ensure the access to safe drinking water and sanitation as a legal obligation for member states. And within those, as was mentioned, we are trying to maximize the available resources. And as was mentioned, those being natural resources, financial resources, and community resources, as was raised by our colleagues from WaterAid Ghana, to ensure sufficient, safe, acceptable, and physically available and affordable water supply and sanitation. On the other hand, for the Global Compact for Refugees, it's a framework which has been agreed at the UN Assembly, and it places the disadvantaged groups and the transient groups firmly inside the resolution of human rights to water and sanitation by enhancing refugee self-reliance and also ensuring expansion of government-led services and solutions to both host communities and refugees. So I'll just take 5 minutes now to go through a very brief case study of work that we have been undertaking over the last 7 years as UNICEF in this region of East Africa. If we could go to the next slide. So the story of this case study really begins with the South Sudanese civil war and the situation that occurred in 2014, where we saw at the end of 2013 conflict which led to a very large influx of refugees into the western region of Ethiopia known as Gambela region. And the refugees since that period of coming to the area of Gambela have make up the 50% now of the region's population. So the total population of today is about 837,000 people, and the refugees are about 400,000 of that population. So when we look at the implementation of human rights access and services to water supply and sanitation, this is a very key and important case study because it demonstrates the important and equitable use of all resources, both natural resources, financial resources, and other resources. So if we go to the next slide, the main response to the challenge of the influx of the refugees to this particular area began with an agreement between the federal government of Ethiopia and the regional decentralized government of the Gambela provincial state to use the available natural resources in the Bara River to serve not only the host community, but also the refugees. And the schematic that is on the slide in front of you demonstrates the well fields that were constructed at the time under phase 1 of the project, where there was an agreement between the community leaders, the chiefs of the particular area, to provide land to the refugees, but not only land, but also the resource, the hydraulic and water resource, to enable them to have access to water. This was successfully done, and so the program had been expanded through phase 2 and phase 3 to then connect these systems through a large reticulation system to about 265,000 refugees, and later on through a solar-powered grid connection in those areas. And it was also then agreed that there was a need to look at the governance of this system, as it was a very large infrastructure investment, by combining both the refugees and the host communities from the different tribal groups into a public utility that would then oversee and manage the system, which has been the operational modality, the OPEX modality, since 2017 for the last 3 years. So if we go to the next slide, there are many lessons learned from the project, but this one just gives you a sense of the scale of this project and how close the project is to the South Sudanese border. The South Sudanese border is less than 5 kilometers from these camps. And so there's clearly, as was mentioned in Leo's presentation, there's a need to progressively improve the level, because we're in a situation where we are receiving regularly increased influx of refugees due to the continual conflict in South Sudan. So there was a need to ensure that the service levels were harmonized between the refugees and the host communities. So on the next slide, we talked through a little bit then what have been some of the learnings from the last 7 years of operation that we have been involved in this area. And perhaps the first one is that, you know, there has been a substantial improvement level in the supply for both the refugees and the host communities, and the Global Compact for Refugees, it places at its center the issue of equity and equitable access for all users. But again, it's a progressive access. It's clearly not going to be possible to reach the highest levels of government service norm from zero. And so in this particular context, the service norms have tried to harmonize both the humanitarian sphere standards, which are used frequently in the refugee context, with the national norms in terms of litres of per capita that are used with the design of the water systems. The second important thing is that, you know, clearly financial resources need to be maximised to their greatest effect to reach the human rights to water. And what we have found is that by planning in advance the integration of all user groups in this kind of approach, we had very large savings for the customers. This particular water supply and sanitation system is very unique in that UNHCR is responsible for paying the bulk meter supply into the camps to the utility, which is a public utility comprised of the host community and the different ethnic groups of Gambela and South Sudan. And this has enabled a real maximum use of the financial resources to get the utility both becoming more localized, but also more sustainable in its operation in that area. So moving then to the next slide. What we are currently looking at is then an analysis that we've undertaken in 2019, where UNICEF, along with UNHCR, has analysed 200 sites across the 7 countries in the Eastern Horn of Africa, from Sudan, Ethiopia, Somalia, Uganda, South Sudan, Kenya, and Tanzania. And we've looked at the potential application of this ETANG model that I presented on the slides as a means of progressively realizing the rights to water and to harmonize the host community and refugee needs in those areas. And based on this, we have now selected and initiated a further project to expand this modality in 4 new locations across Somalia, Uganda, Ethiopia, and Sudan. So on the final slide, I just wanted to mention that what I've tried to outline in this case study is a very scalable intervention that clearly is addressing the needs of hundreds of thousands of people, both refugees and host communities, and it's a very real example that has been implemented and is being operated for a number of years. There are a lot of good learnings from this case study, which could potentially feed into both the dialogue around human rights and access to water and other components. So I'll stop there, and many thanks for your attention.
Thank you very much, Dr. Samuel Guthrie, for this example, which I find particularly fascinating in terms also of combining the host communities, the refugees, and how they can manage together the water and maximizing the resources, as well as improving the services for all, right? And something that which I would presume as another outcome is also reducing the level of conflict that we see sometimes in across different places between host communities and refugees. So another very interesting example of how to make progressive realization real. And now it is time to come to the questions and raised by the different speakers, I mean by the participants to the different speakers. I will start in order as the questions keep coming, and I will try to summarize a couple of questions for you, Leo, first. I won't be able to read up all the questions. I will just need to pick a couple of them, and I will go then first to you, Leo. So then from the participants, there was one question about if there shouldn't be a right to knowledge of the use of local resources, both natural and those of traditional production processes, along the human right to safe drinking water and environmental health. So just to for the people in vulnerable communities to be able to know what's going on with their resources, right? So that is a question for Leo. And a second question, or a couple of questions that I will summarize, refer to the role of private actors. Because one participant raised the point that in your report of progressive realization, you have raised that the private actors working in water and sanitation must understand that they are bound by human rights obligations, particularly when they provide services by delegation. So Neil Dodd asked about if a private operator is working under contract and compliant with the laws of the state, where the human right to water and sanitation is enshrined, how can you say private operators do not understand their obligations? So perhaps is to clarify that the role of the private and the obligations of the private actors, which has been also asked by another participants in terms if you can extend what would you say are the obligations of the informal private service providers. So I'll stop there to give also questions to the other participants. So Leo, I hope you got these two questions on the private sector as well as in terms of the additional rights in the knowledge and use of local resources. Over to you.
Thank you, Alejandro. Thank you, the questions from the participants. Yeah. Look, let me start with the second question about the obligations of what we call the non-state actors, that include the private sector and also the informal providers. Actually, if we are accurate in terms of language, those actors that provide services by delegation of states have responsibilities in terms of human rights, not really obligations, being very accurate in terms of language, that are a little bit different. Responsibilities is not the same of obligation because it has less legal implications. But increasingly, there are agreements at the international level that private actors should be bound by obligations in terms of human rights. There are some treaties in negotiations at the Human Rights Council that try to include the private actors in terms of obligations. So this is very important. What is most important in my view is that the obligation of achieving and meeting the human rights obligations are of the states. But when the state delegates the services to the private actors, they are still bound by those obligations. So in this case, the private actors or community providers are a kind of arm of the states in terms of realizing the rights. So if the private actors fail in terms of meeting the obligations of the state will fail also. So there is a need of connecting the way the private actors are realizing the rights or are providing the services and the obligations of the states. And in some countries, a key actor in this process are the regulators. So the regulators should ensure that the private actors realize the rights in name of the states because they are delegated by the states to realize those rights. So this is a summary of a lot of things I needed to say about that. And I would invite you to read my other report that I will present to the General Assembly in October. It will be published soon, in some weeks, about exactly privatization of water and sanitation. The other question is related to natural resources, I would say water resources. And it is an interesting discussion, not very straightforward, because for instance, if I think on the special procedures of the Human Rights Council, the rapporteurs, I'm the rapporteur on the human rights to water and sanitation, and I have a colleague, David Boyd, that is the rapporteur on the right to a healthy environment. So when we think on the availability and the quality of water in the natural expression of water, groundwater or surface water, we are talking on an issue that is in the boundary between both mandates. Why I'm talking about boundary? Because when we think on water in general, we should think on the several uses of water, not only the use of water for human consumption. But it's very frequent that water in its natural expression is used directly by rural population, indigenous population, and in this regard, there is a very interesting overlapping of the two rights. So I agree with the person that asked the question. It's very important to have a very reliable, free, and accessible information of the state on the status of the natural resources, because in some cases it has to do with the realization of the rights to water.
Thank you very much, Leo, for those answers. And I will move to other questions. This time, I would like to ask Fausia from a participant a question that says that in strengthening the supply side, how do government officials react to your advocacy or to the advocacy by communities, especially given the challenges with decentralization in practice? And I will also ask a question for Sam to respond after Fausia, and link to what would you see the government leadership in developing these agreements and this project that you have talked about, being them the primary duty bearer, and how is this like complicated with the issue of refugees and the international agencies that, of course, refugees have the intervention of other external agencies. So yeah, how was the government leadership and how did it evolve over time? So these are the two questions. Over to you first, Fausia, if you are with us.
Yes, thank you very much, Alejandro. With response to the question, from our experience, the local government authorities have been very receptive. They have been very supportive, in a sense that a lot of allocations, budgetary allocations, are done at the regional, at the national level. But then sometimes most of these allocations do not really reflect the needs of the community. The local government being present and closer to the communities kind of sometimes feel restricted. So in terms of our advocacy and our work with them, the local government have been very supportive. With regards to advocacy by the communities, I would say that it's more of the assembly saying or always responding that, okay, we know you need water at the community, we know you need public toilets, but then we don't have the resources. So for me, if I'm going to look at it, I would think that it's more about prioritization and water aid as a whole. It's more about prioritization of the assemblies, of the needs of the people, because we see a lot of funds being used for other things when they could be used to provide things as basic as water services to people, and then sanitation as well. For example, we've had in 2 districts where the national level budget allocation to the districts have been reducing from 2016-17. But then because of the work that we have done, we see at the district level, the district assemblies increasing allocation for the provision of water and sanitation. So for me, I would say that despite all these challenges, we would be able to actually reach people or provide services, water services to people, if we actually prioritize. And that's one of the key things Water Aid seeks to do, working with the government and the communities to ensure that the local government and even government at the national level prioritize the provision of these services over others. Thank you.
Thank you very much, Fauzi, and also for giving a positive example and hope that things improve when we connect communities and the government at the local level. Over to you, Sam, for the question about the government's role and leadership over time in this very complex situation. Thank you.
Yeah, many thanks for the question. And as you said, very complex situation. Maybe going back to the World Humanitarian Forum and just reminding ourselves that the outcomes of that were really these commitments towards the Global Compact to Refugees and also the Comprehensive Refugee and Returnee Framework. And member states following that became signatories of those particular conventions. And I think what we're seeing in our region is the governments themselves showing a commitment, both in terms of signing up to these particular initiatives, but also then putting specifically resources behind them. So the governments have that duty bearer responsibility, but in the context of these schemes, we are following very much a delegated management framework approach. So the government has a responsibility in that context, both to be an asset provider, so in investing public resources and also coordinating and mobilizing external resources for these investments. But probably more importantly, within that delegated management framework, they also have the direct responsibility for the process of regulating the service. So regulating the service in terms of then the liters per capita that might be provided to the different groups, but also the pricing and the affordability and access to those services. So in summary, to say that the government leadership in this process is evolving and has been central from the beginning, but it is changing as the schemes develop and expand.
Thank you very much, Dr. Samuel, for that response. And I would like to keep the discussion, but we are out of time. So, and I know there are other sessions starting at 5. So I would like certainly to give the word to Ms. Luisa Gosling, Senior WASH Manager at Water Aid and the Chair for the Rural Water Supply Network, to give us her views, her concluding remarks. What do we take away from this session, Luisa? Thanks.
So thank you very much, Alejandro, and thank you to all the presenters. I think that this kind of like articulation, what does this human right, this inspiring and also aspirational concept that water and sanitation are human rights, and that has got the commitment now of the international community and states, how is that put into practice? And I think we've heard really concrete suggestions that are very difficult, but also really clear on the progressive realization. We heard about what that means, how that can be defined, and then it was illustrated that the importance of government leadership, that really the state has that obligation. And then the question then is, how does that obligation get implemented? We've heard about the importance of governance in that implementation. So the way that the refugees and host population has to have a clear way of governing the distribution of water between that, and thinking clearly about that decision making so that it will be sustained. But also this real need for people at every level to understand roles and responsibilities. And Fauzi spoke about the need of the communities to understand, but also the local government and the district assemblies don't necessarily understand their responsibilities. And that's really that first really essential part of the process. We also talked about maximum resources, and I think this is really the points here made about efficiency, efficient use of resources, lack of stopping corruption, stopping the wastage of resources, and that includes the money, but also people, time, and the natural resource, as well as information. And sometimes I think we underestimate the importance of information to people at every level to be able to then mobilize other resources. We heard from Sam about the importance of how many there is money in the system. It comes through vertical sources. So it's a very inspiring example of bringing together the sources of money for refugees, but really making sure that is combined with what's available at the federal and the state level in Ethiopia. And I think another point about the resources that Fauzi raised is the importance of pressure from civil society and from community to know those resources and to push for those resources. And we know that for people who are marginalized, unless they raise their voice, unless they're able to know what their rights are, then those resources will not flow towards them. This concept of minimum core obligation is also critical. It recognizes the terrible situation that so many people still live in respect to water and sanitation. And I think this concept of a floor beneath which it is really unacceptable for a government to let the people in its care to fall is extremely important, and it helps this question of prioritization, because it will always be very difficult for governments at every level to prioritize scarce resources. But this concept of a minimum core level and then the progressive realization, both vertically in terms of services, but also horizontally to reach everybody, is incredibly important. So I'd like to thank the speakers for first of all, to Leo for really and his report for articulating in concrete detail, tangible detail, what these obligations mean, what states have signed up to, and what all of those of us who work in this sector are working towards, and to use this framework as a way of bringing together our efforts to work more efficiently, to really reach out to those who are being left behind, and to be able to use our not just money but also the energy and the taking care as well of the natural resource. So thank you all very much, and thank you, Alejandro, for hosting this meeting.
Thank you very much, Luisa. And with that, I think I will just want to close the meeting and tell you all that thank you for your participation, both the speakers as well as all of you who are at the other end of the line. And then just to say that at the link of the event, we will then put up some key resources like the report from Leo, other documents from the different initiatives that we have seen presented today, as well as the recording of the session later on. So thank you very much for being there. Stay tuned. There will be more World Water Week at Home good sessions, and yeah, stay safe. Take care. Bye.